Prostate cancer is actually a very common disease. About 280,000 men are diagnosed every year with prostate cancer. Around 35,000 men will die every year with prostate cancer. It's actually stated that about 1 in every 8 men will develop prostate cancer, and about 1 in every 40 men will die from prostate cancer. So it's a very prevalent disease. Also, another fact that is true about prostate cancer is that it is the most common cause of cancer death for men in this country, and it is the second most common cause of cancer in general, with only lung cancer being ahead in terms of the numbers of cases of cancer that are diagnosed either for lung cancer or prostate cancer. The most common symptom for prostate cancer is actually no symptoms at all. Most men are diagnosed with a PSA test, blood test, and most of the time men are asymptomatic. However, a man can have symptoms from prostate cancer with trouble avoiding, trouble making urine, usually starting the stream, having hesitancy, or even some irritative symptoms. But most men are actually asymptomatic when they're first diagnosed with prostate cancer. But there are some patients, some men in the population who are at higher risk for developing prostate cancer. And those would be patients who have a family history of prostate cancer, especially a family history where there are numerous relatives either with prostate cancer or with breast cancer. And that is because about 10 to 12% of men will have a germline mutation, meaning all the cells of their body will have a BRCA, which is the BRCA1 or 2 gene, which is known and sort of understood in the community, I believe, to be one of the risk factors for breast cancer. However, it's actually very common now, as recent research has shown. I think also African American men are high risk, and the current screening recommendations are for men with family history or African American men to be screened at a younger age, about 45 instead of 50. And so those would be the populations that are highest at risk. Prostate cancer is actually a very similar cancer in terms of its management for the localized prostate cancer when it's still confined to the prostate. It is a disease that is strongly hormonally driven, and so testosterone as a hormone in the man's body will drive the growth of the prostate cancer, and therefore it can be a very successful way to treat the cancer when you remove testosterone from the body. So for a man who has advanced disease, patient's first treatment is usually to remove the testosterone with either medicines or surgery so that the driving force of the cancer is removed. That is similar to breast cancer, which is also a hormonally driven cancer, but not a lot of other cancers have that same sort of treatment pattern. The other thing that separates prostate cancer from other cancers is the time course. It can be a very long and drawn out cancer, where men can be treated for a primary treatment with either surgery or radiation, and then sometimes relapse many years later, as much as 5 or 10 years later. That is a not uncommon scenario with this disease. So the time course of its long-term existence is very different than many other cancers.